fast are oxygen delivery devices? Huh? Fast? Last 10 minutes. Huh? So in mass only there are different type of mass. What is Venturi mass? Venturi mass. Anyway, it is not there, but if you tell, you have to tell Venturi mass. It means it is allowed to deliver how much ever FiO2 you want. So what is FiO2? Fractionated oxygen. What is the normal environmental FiO2? What is Fi boys in this class? What is the fraction of boys in this class? Huh? 4, and if there are 1000 girls, 4 is to 1000. How many girls are there that you calculate? Huh? 11 girls, 4 boys. So what is the percentage of boys? 4 by 15. How much it is? So for easy calculation, include 5 by 15. 23%. Around 30 to 33%. So like that, what is the FiO2 of air we are breathing? I don't know why I have to teach you chemistry, physics and everything. So whatever air we are breathing has, how much oxygen and how many other gases?
Sir, 20%.
Huh?
70%.
Yes, it is. How much? 21% oxygen. Understood? So if you want to increase that percentage, so specific percentage what you want. For example, you want 40%, you want 50%. Then it is possible by mass or specific mass. Understood? Otherwise, if you just give oxygen by prongs, the maximum it can go is 30 to 35%. Understood? Then by mass, how much it can go? 40 to 50%. But if you want to give 60%, 70%, so you need to design a mass which has more flow and not allowing other gases inside. Understood? So those are called Venturi mass, which have different percentages. So what if you want to give 100% total? So whatever molecules which are going in air are all oxygen. Non-rebreathing mass. Open your Google. It will be kept in your exam because it is not there here. The exam thing will be kept. Open your Google. What is non-rebreathing mass? So whatever oxygen is coming, so it will get collected in a bag. Okay. So and there will be no escape route. So only one expiratory limb will be there. Other air will be collected in the bag. So there will be least amount of mixing. So it can give 90 to 100% FiO2 of oxygen. Understood? These are about the oxygen delivery devices. Any confusion? What are all examples? Nasal prongs, mask, Venturi mask, and so if nasal prongs is ideal, then we should have only one. So nasal prongs has drawbacks. Drawbacks means you can't give higher FiO2. Then you can't give more than 3 to 4 liters. Otherwise, currents will be created and it will cause discomfort to the child or person. Understood? Then mask, what are the disadvantages? Again, you can't give FiO2 more than 40 to 50%. So again, more than 5 to 6 liters if you go, there is of no use. If you give extra, it will be wasted. Understood? So then we have NRBF mask, which can give 100% FiO2. Understood? These are all the oxygen delivery devices. Next respiratory device is, what is this? I'll give that syringe you give it fast. What is this? Fast. Okay, indication of action delivery devices. If you answer nicely, then they'll go for this indication. And you give option to somebody. Huh? In pneumonia, in shock, very good. Then, okay, all of a sudden person comes to SPO to below 90%. It should have some reason, no? That is what they expect to. Yes, any cyanotic congenital heart disease or cyanosis due to any other cause. So most common cause is pneumonia. That is what you have to know. Then, first, what are these? What are these? Give it to boy. Very good. What? Oh, is it given as a toy to children to play? Huh? Very good. Endotracheal tube. So where do you put it? Where do you put it? Intubation is a procedure of inserting endotracheal tube inside the. Where you will put it?
Trachea.
Into the trachea. Through what? Through stomach you will put it into the trachea. Through oral cavity. Through oral cavity you put it into endotracheal tube. The procedure of putting it is called intubation. Understood? So you can just, if you put it, you will go. What do you want it? What do you want? So you want laryngoscope and blade. So two types of blades are there. One is the straight blade, another is the curved blade. Whom do you use straight blade? In children we use straight blade less than 2 years of age. So after 2 years, 3 years, elderly child, adult you use curved. So as you know, there are different sizes, and it is cuffed and it is uncuffed. Understood? Cuffed means you inflate the cuff so that it is tightened and it doesn't move. So uncuffed you use it for very small children less than 1 year, and cuffed you can use it for. So cuff, what is the uses of cuff?
Stabilize.
Yes, one, it is stabilized and it will not move. Then aspiration, because it will be cuff, so whatever is coming out of the esophagus will not go into the trachea. Understood? What is this? So Foley's catheter. So what are the indication of endotracheal tube insertion in intubation? Indications for intubation and endotracheal insertion. Bronchoconstriction, anaphylaxis, gastritis. Gastritis, why do you want to do into the trachea? Inability to feed means you put endotracheal tube and feed it to the. First thing is not able to maintain the airway. Okay, in which case you will not be able to maintain the airway? One is excessive secretion, but excessive secretion can be sucked out. Why you want to intubate? Next comes to suction catheter. So excessive secretion, if she told it is there, means what do you do?
Suction.
So what can be the excessive secretion? Apple juice, pomegranate juice, drinking excess. Okay, one is the bronchial secretion like sputum and other things. Other? Aspiration of what? Huh? Breast milk aspiration. Yes, milk can be excessively present there. Then, what are the secretion which can block the airway? Blood, not the inbreeding disorders. So blood. So then you can do suction. Okay. If secretions are there, you can do suction. Why do you want to put the endotracheal tube? So if the person is unconscious, not able to maintain, what happens in unconsciousness?
Tongue falls
Yes,
back.
tongue will
Fall back.
Then they can't. If there are gastric aspiration, they can't throw it out or they can't swallow. So what happens? The chances of aspiration will be more. So to protect the airway and to make the airway patent, so we can use endotracheal tube. Next is for ventilation. When do you use ventilation? What do you mean by ventilation? Mechanical ventilation. You have seen the intubator. You have seen the mechanical ventilators. So in case of very severe pneumonia, you are giving oxygen by prongs or all this, but child is not able to maintain the respiratory rate or respiratory effort. Then you want to putting on mechanical ventilator. If you want to putting on mechanical ventilator, then you have to intubate the child. Understood? These are all the indication of intubation and use of endotracheal tube. So as you know, different sizes will be used to different
Age
person.
group.
So different age group. That is all next. Good to know things. So as you don't have time, we will do. If you have any doubts, at last you can ask. What is this? What is the indication first? For this, to tie the person to the bed so that he should not be mobile. Huh? To monitor urine output. If the person is passing and collecting in a bottle, you can ask.
Unable to pass.
So one is urinary retention. So why one person's urine will be retained? Person is not able to pass urine.
Calculus.
Huh?
Calculus formation.
Calculus, if you put catheter also, the calculus will be there again. Huh? Sickness means this only different. One thing is posterior, so impartial obstructions. Then, UTI, why? You have to introduce a foreign body and make more infection.
So in case of major procedures.
Unconscious, can you pass urine? Few people can pass, few people can't pass. Then, if he is not able to pass, then you have to put. So then, spine injury. So his bladder control is lost. So he is not able to pass. Then you have to put. Then, yes, in case of strict urine output monitoring, you want every 30 minutes how much urine is passing. So usually, person will pass in 4 or 5 hours. But you want every 30 minutes how much is the urine output. In case of shock, in case of dengue, then you have to put catheter. Then
Surgeries.
yes, any urology surgeries. Good. Then collection of urine sample, better to go for suprapubic aspiration of urine. Not like it. Yes, in small children you can do it, it's not possible. Understood? These are all the uses of policy. Okay, if they ask how to insert, how to do the procedure. Okay, you learn it. Okay, what are syringes you have given? You have taken it back, huh? Okay. What are these vaccination? So you should know the national immunization schedule. Okay. What are the syringes used for vaccination? You have seen the other syringe. What is it different from this syringe? What is it different? What is this? What is AD? Why it is written AD there? AD. Is it Adidas and it has gone on? Why is AD written there? What is this say different from the other? And what is the other syringe, big syringe? Huh? What? Needle. What is the difference in needle? So that means a examiner gives you 2 minutes also. By reading the label also you are not able to answer. What is this? This is insulin syringe.
Insulin syringe.
What is it?
Insulin syringe.
Insulin syringe. So the whole thing contains how much? You take the whole thing, how much ml it is? Whole, full. Huh? How much? 1 ml. So what do you mean by AD and it is given 0.1 ml? AD is automatic. Huh? Disposable. Automatically disposable syringe. So if you take 0.1 ml, why do you take 0.1 ml in what vaccination you take 0.1 ml? BCG. So these are intradermal injections. Understood? These are insulin syringes. Again, if you don't have this syringe, you can use it for this. But what happens? So you give 0.1 ml. 0.1 ml means 4 units. Because the whole 40 units as 1 ml means 4 units is 0.1 ml. So you give 0.1 ml intradermal to the person. So can it be reused? No, so it can be reused. So to prevent reuse, it was introduced. So once you plunge it, again you can't refill it. So the plunger will be broken. Understood? Okay, what are the other syringes we are giving you? What is this? This is also automatically disposable syringe. It takes 0.5 ml for intramuscular injection. So once you use it, you can't refill it back. Understood? So to prevent refilling, so AD syringes were utilized and these are the ones which are used for immunization. So vaccines and all, so you are aware of the vaccines. So all the national immunization vaccines are must. What is this?